I think sometimes people start something, a TikTok, a YouTube, or whatever, thinking, oh, they're going to get 10 million followers and make a bunch of money. Realistically, very, very few people reach that level of success, right? But and to a lot of people, like to your point about consistency, it's a lot of people, they think, all right, I'm going to get 10 million followers, and they put out a bunch of things that they work hard on, and then like nothing happens, like it's crickets, right? And then they're like, oh, this is not a waste, this is a waste of time, I'm not going to do this anymore, and then they go and try to do something else. And again, it depends on your motivations. If your motivation is getting rich quick off of something, then brace yourself for when that doesn't happen. If your motivation is just to educate people, or using it to build relationships, or using it for maybe even to support your job or support something else, then you can find creative ways to leverage it, right? Like you may not really make money from that one thing that you do, but because of the skills that you develop through doing that and experimenting and all that, you leverage it for something else, right? Like marketing, I never, like I said, I never studied marketing. I never started out in marketing, but I experiment with different things on my own, and built a lot of relationships and got really good at building relationships, and then leverage it even for my my day job.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 92. Hi everyone, Omari Richards here. Thank you all so much for joining me. Be sure to follow me on Instagram at the PH Millennial. Be sure to subscribe if you have not subscribed to this podcast. Leave a 5-star review, share with a friend. Greatly helps the show get out to more people. If you'd like to support the show, you can go to thephmillennial.com/support and find all the different ways to support there. I really enjoyed today's episode. There's definitely a lot that I could have continued the conversation and spoken about in this episode, but I like our discourse, especially around like social media and things around that, as well as just learning more about marketing. And I think this person has an interesting path in public health. It's coming out of MPH, getting into a startup tech company, which isn't something that you usually hear people say or talk about. So I think there's just some great insights overall. And just be sure to follow him because he's sharing some great information on LinkedIn these days. But enjoy. Today, we have a healthcare strategy and education leader specialized in launching new products, programs, and services. He got his Bachelors of Arts in Psychology and Social Behavior at the University of California, Irvine. He then worked for a bit before getting his Masters of Public Health at San Diego State University. He currently works as a Senior Manager of Strategic Marketing at UCLA Health, as well as a writer and speaker with PurposeRedeemed. You may know him from sharing insights and inspiring hope on LinkedIn. Be sure to subscribe to his YouTube channel, PurposeRedeemed. We have Christopher K. Lee, MPH. Welcome to the show.
Thank you for having me.
It is my pleasure. I feel like you are the person that I see on LinkedIn in the public health sphere posting the most right now. So I appreciate you taking time to come on and share more long form about your story and about some insights that you have to share.
Yeah, thank you for the invitation. I'm excited to be here and share a little bit about how I made my career decisions as I went through my roles so far.
Awesome. So how are you doing and how have you been coping during this time?
I'm hanging in there. Thankful for everything I have. Haven't caught COVID yet, so very thankful for that and keeping healthy and safe so far.
Well, that's good. Well, I'm glad that you're doing well, and you're I don't know if it's a majority or minority of people. I feel like most people have caught COVID by now, but that's good that you have not. Hopefully that stays that way. So how do you identify, and then tell us a little bit about your personal background?
Yeah, so I grew up here in Southern California. My parents came from Vietnam, and I went to school, as you mentioned, at UC Irvine, and then at San Diego State for my grad school program.
Okay, awesome. Well, thank you for sharing that. And before we hop into your story a little bit more, what does public health mean to you?
That's an interesting question, especially through this pandemic. I think a lot more people have been more aware of public health, even that term public health and the public health agencies that are out there. To me, what it means is setting the structures and the infrastructures, the programs, the processes, all those things in place to keep people healthy. And if they get sick, then to take care of them in the best ways that we could. A lot of times people think of public health as things that are directly related to, let's say outbreaks, contact tracing and all of that stuff. But to me, public health is much larger than that, especially coming from healthcare, where we often talk about social determinants of health. So we'll get more into it, but at a glance, that's what I would say public health means to me.
Yeah, and I like that. Yeah, I think it's very important to focus on that infrastructure part because it plays a big role in our health. And as you said, the social determinants of health that, as we all talk about in public health, know how just important that is. Mm-hmm. Okay, so getting into your college story now, you got your Bachelors of Arts in Psychology and Social Behavior at the University of California, Irvine. What was the thought process going into undergrad?
Going into undergrad from high school, I didn't really know what I was going to do. When I was in high school applying for colleges, I applied for all sorts of things. I applied for English. I applied for classics. At that time, I had taken Latin for 4 years in high school. So I even applied for that because some people say it's easier to get into the school because nobody wants to do that. And then you can change majors, right? I grew up as a musician, so I even thought of going into music composition and production. I was kind of all over the place going into college. When I was I went to a community college for a year before transferring to UC Irvine. And while there, one of my friends who went to a different school, she was majoring in psychology. And when we were just catching up, she was telling me about all the interesting classes that she was taking, all the stuff that she was learning. And I thought, I never considered taking psychology as a major. So let me look more into this. And at that point, I decided, all right, let me go get my undergrad in psychology and then kind of go a very linear path to get my master's and PhD in clinical psychology. Long story short, that didn't happen, but that's how I had decided on it.
Okay, awesome. Well, thank you for sharing that. And I think that's not unlike many of us going into university, just not really knowing where you want. But that's a little funny that you apply to Latin programs because it's easier to get in and then you can switch your major. That's a pretty smart way to think about it, if we're being honest. And then you mentioned that you went to community college. Because I personally feel like community college is not spoken about enough. It's not utilized enough. What was that benefit? Did you get a benefit out of that 1 year in community college before you moved on?
Yeah, absolutely. So the community college I went to literally is across the street from where I was living. So, I didn't even have to drive there. Most days I just walked over, right? So it was very convenient. But then, the main thing that people usually go to community college for is you save a lot of money, right? I don't know how much community colleges cost, nationwide or, at this time especially. But when I was taking it, I think in the 1 year I paid like $1,000 or between $1,000 and $2,000, as opposed to, let's say, closer to $10,000 a year at the universities. So definitely that saved a lot of money. That was helpful. Yeah. And also, I think the other thing that just came to mind here. The other thing is it gave me more time to explore, right? It gave me time to decide, actually, maybe there's no point getting a music composition degree for me, but personally, if I wanted to do music, that would kind of continue to be my hobby. There's no point majoring in Latin and spending a year or two studying that. And then, I was like, I save money, but I also save time and really decide, okay, what is it that I want to invest in rather than just kind of meandering through my journey.
Yeah, I think that's very important that you highlight that because I feel, especially a lot of us go into university at age of 18, which is very young, still not really sure what we want to do. And to your point, going to community college, you're going to get the same basic classes that you're going to get at the university at a much lower rate. And it affords you that time to really think about what you want to do and think about other schools that you can apply to go and complete your degree. So yeah, I'm a huge advocate for community colleges, and I'm going to continue to say that because I think a lot of people don't utilize it as much as they could to this day. And then one other thing, so you said you played music growing up. What instruments did you play?
Mostly piano. I did take a violin in elementary and middle school, but I'm no good at it. Mostly piano.
Okay, awesome, awesome. Well, thank you for sharing that. And you still play piano to this day, or not so much?
I still play. I would not say that I am, you know, that I practice enough, let's say, but I still play and I still enjoy it. Yes.
Okay, awesome, awesome. And I always like to like bring in those other little hobbies that people have that aren't necessarily public health related.
Right.
So were there any other takeaways that you had from your undergrad experience?
When I was in undergrad, people tell you to go get research experience and do an internship and volunteer and all this stuff, right? So I got involved in a bunch of things, thinking it would be helpful for my resume and for helping find a job after college or even during college, right? One takeaway that I would say I learned in college is that not every experience is created equal. Not every experience is as valuable, right? At that time, my resume was pretty blank, so I just wanted to keep adding line items to it. Get involved in this club, get involved in this research thing, do this internship, do this volunteering. How many of those things have actually helped me in my career? I would say very few. Now, there are certain things that were helpful in terms of knowing that, okay, this is not an area I want to go into, or helped me meet people that I otherwise wouldn't have met. But in terms of it being something that stands out to employers, there are things on my resume where it's like, back then there were things on my resume. It's like, oh, you got Phi Beta Kappa, you got this honors, you got this degree, this certificate or whatever. And like, I've never been asked about that, or in an interview. Like, nobody has ever really cared about that sort of thing. So I would say, not every experience, not every line item is worthwhile, let's say.
Yeah, and that makes a lot of sense. And I think that begs the question for a lot of students, especially students, to audit the opportunities that they have and see if it really aligns with the whether skills or experiences that they are going to gain. And I guess to the devil advocate point on that is like, take the experiences to know if you like this kind of thing or if you don't like it. But that, as we've seen, there are two sides to it. And as we know, time is very valuable. So I appreciate you sharing that.
Absolutely.
So then you graduated from University of California, and then you got a job as a valuation analyst at Transition Consultant. So how do you come across this job?
Yeah, that was interesting. So this one I actually found on our, at UCI, I guess every college, they have a thing where you log into and you kind of see jobs that are posted to the students, right? So it was on this system. I don't know what they call it now, but I had logged in. I was at the library. I remember this specifically. I was at the library waiting for a friend to hang out after she got out of class. And, in the meantime, I was like, oh, let's just find some part-time job or, something. And I just, submitted my resume to a couple of them. And then, we went to hang out and stuff. I came back that night and I saw that this job had already reached out to me like within 20 minutes of me applying. So I was like, oh, interesting. All right, let's, see what this is all about. Yeah, that's how I found that one.
Okay, awesome. And so what did you do in this role?
Yeah, so this was for a business. So about Transition Consultants was a business brokerage for independent medical, dental, and other healthcare practices. So a lot of times, as a valuation analyst, I would help appraise medical practices and other practices, right? So what that means is, a lot of times the doctors who, they ran their small business, they were practiced for however many years, they're retiring, they want to sell their business to somebody else. So they would come to us and say, all right, I want to sell my business, what is it worth? And then we would analyze their financials, we would analyze the current market, whatever assets they may have, and come back to them with a range or a number, right? This is about how much you should expect to sell your practice for. And then they can decide, all right, should I sell, should I not? And they kind of make their decision based on that.
Yeah, that's very interesting. Not something that I think about a lot, but definitely is something. So you're doing a lot of like private practice valuations for people that are retiring and want to sell potentially.
Yeah, well, mostly retiring, but also people who are, relocating, or they just don't want to run a practice anymore, right? But, a lot of small practice owners would tell you nowadays there are too many regulations, there are too many costs with the EHR and all this stuff, too many compliance rules. We keep reading news of how many hours doctors spend in front of a screen instead of in front of their patients, right? So a lot of people, they just don't want to do that anymore. They just prefer to go work for somebody else, and therefore sometimes they come and sell their practice as well.
Okay, yeah, and that makes a lot of sense. Um, I guess I could get a little nitty on this, but I will not. I'll just leave that because I feel
Yeah, I
like
was trying
that.
to figure out like how much like do I do, because I was like, wait, probably need to explain a little bit about it before people know what it is, right?
Yeah, and so okay, I'm just ask a quick question there. So around the valuation, I'm guessing you're doing the valuation of like the actual, whether it's like products and different physical things that they have, the buildings and whatnot, and then also looking at maybe like cash flows and revenues and
Yeah.
maybe like customer basis and all those kinds of things.
Yeah. So, basically, now most medical practices don't have that much in hard assets, right? Like a lot of times they're just leasing the office, so they don't really own that either. They might own some of the equipment, but it's not really worth a whole lot. Now, for some types of practices, there are a lot more in dental practices. There's a lot of things that they actually own, right, physically. For most medical practices, much of the value is what we call goodwill. It's part of your brand, it's part of your current customer base, it's the operations that you have already running the business as what they call a going concern, rather than just valuing it in terms of like taking it apart and selling every piece of equipment.
Okay, yeah, that makes a lot of sense. And this is a job for like a bachelor's level student typically.
I guess. Well, so yeah, I would say so, but again, that's not a public health thing or even psychology. They just they just hired me because they need to write a lot of reports, and as a psychology major, I wrote a lot. And I was good at decently good at math. I would say if you're a business major, this would be probably something that you know is a lot more typical for them.
Yeah, and that makes sense. That makes sense. Okay, thank you for sharing that. And then how long were you in this position?
In total, I was there about 2 years, but halfway through, I had moved to San Diego to start my grad studies. So I was doing it part-time remotely from then.
Okay, that's awesome, and that's great that they allowed you to do that as well. So
Yeah.
you got your master's of public health at San Diego State University. How did you hear about public health, like before applying to get your MPH?
Yeah. So, part of the decision was because I was working at Transition Consultants, right? Working on the medical healthcare space. And going into college, I knew that I never wanted to be a doctor, a physician or a nurse or somebody who's clinical. A lot of my friends went into college knowing that that's what they wanted to do, right? Or thinking that's what they wanted to do. That wasn't me. When I started working at Transition Consultants, though, it helped me see that there's all this administrative or business side of healthcare that I knew nothing about. As a psychology student, you don't really know this, what goes on behind the scenes here. So, based on that, I started looking into other healthcare administration, healthcare management type jobs. What's out there? What do they typically require? And I saw that a lot of jobs require you have to have a master's degree. Usually either an MPH or an MHA or something else, right? And at that time, the Affordable Care Act was, something people were talking about a lot. Population health, preventive care. So I thought public health, that seems to be the way of the future. So that's why I decided to get the MPH instead of the MHA, let's say.
Okay, and that makes sense. And that's one thing I always highlight to like MPH students is like when you do an MPH, you tend to have a lot of the skill sets that the MHAs have, plus some. And when you do an MHA, you tend to have less of like the skill set that public health students have, but you have more of the health administration side, or like just more of like the hospital knowledge, which is kind of isolated. That's why I say like if you're thinking about going into public health and going into health administration, just do an MPH and get some experiences in a healthcare organization. So because I think you just broaden your horizons in that sense, as opposed to kind of like strictly getting into that MHA route, which is strictly for more so health administration that you're going to be focusing on your career path on.
Yeah, and certainly I think once you get a few years of experience under your belt, people kind of move in, and whether you're in the hospital or you're in any more traditional public health kind of space, it's kind of interchangeable at that point. But certainly the foundation that you're learning, there is a slight difference there, like you were addressing.
Yeah. So what was the big thought process for you getting a master's degree? Were you like, I always wanted to pursue a master's degree, and then you kind of found out about this MPH because it's like auxiliary related to healthcare, and as you said, the Affordable Care Act was passing and all these kinds of things, or at least there's conversation around it?
Yeah, well, as I mentioned, when I was an undergrad, I thought I was going to go get a master's or even a PhD in psychology, right? So graduate studies was always in my mind at some level, um, and at this point, I decided, all right, if I wanted to move on from what I was doing, and so now I was only there, as I mentioned, 2 years total, but certainly I wanted to open my horizons or open my trajectory up a bit, right? I don't envision working at that place forever. I wanted to set myself up with the right skills, with the right knowledge base in order to have options of where I want to go next after that, however long I stayed at that one.
Yeah, thank you for sharing that. And that makes a lot of sense. So going into your MPH, did you have a concentration or were you a generalist?
Yeah, so the concentration I was in was called Health Management and Policy. I think they have changed the name since then, but that's what it was. It's focused on the healthcare business. Well, it's focused on the business or administrative side of healthcare.
All right, awesome. Well, yeah, so did you align your concentration with deciding that you wanted to go into like this health administration, or like just a lot more focused on that side of things, or what was the thought process in the concentration choice?
Yeah, I wanted to go into health administration or health management or whatever you may call it. So all the places I applied were in that kind of concentration. They call it different things at different schools, but essentially, reflecting going into working in hospitals, medical groups, other public health agencies and such.
Yeah, okay. And then during your MPH program, you were a project coordinator at the Hospital Association of San Diego and Imperial counties. So tell me a little bit about that experience.
Yeah, so as part of my program, like a lot of other programs, you need to get X amount of hours of an internship, working somewhere that's related to the program, right? So the opportunity that came up for me was at the Hospital Association here in San Diego and Imperial counties. Now, the Hospital Association is a advocacy group on behalf of the hospital members. And I was in the Quality and Patient Safety Department, which, we worked on a lot of projects, talking to our members about collecting certain data points. There were things that we wanted to reduce, like we wanted to reduce, any adverse events and that sort of thing, things around sepsis, C. diff, other things that we were talking about at the point that the hospital should be aware of, because either regulatorily or from the health insurance companies, they wanted to make sure that we're reducing, all of these adverse events or hospital-acquired infections and other things.
Okay, that sounds like a pretty cool job or gig or internship to get during your MPH program, as well as just giving you great experience for the things that you get to do afterwards, which we're going to talk a little bit about in a second. So part of your MPH program, was there any other takeaways that you had from your MPH program?
From my MPH program, I would say, well, this isn't in the program specifically, but during that time, one of the things that they, in my program, they always promote to us is getting involved in professional associations, networking, meeting people, right? And this was a significant thing for me because as an undergrad, I never really did that. As an undergrad, I was a psychology major. Psychology students, you have you have a few clubs here and there, but it's not the same as, let's say, some of my business student friends who, they have these events where they had speakers come in from big name organizations. They did the whole, dressing up, exchanging business cards, meeting people, right? I never really had that experience in undergrad. So for me in grad school, that's when I really got my start of, going to professional events, whether they're education events or networking events, meeting people, volunteering and being involved in some of their committees and such. One of the groups that I was a part of here is called San Diego Organization of Healthcare Leaders, which is a local chapter of the American College of Healthcare Executives, which is a national organization for healthcare managers and such. So that was one of the big things that I took away during my time there, just meeting a lot of people, especially in the San Diego area, and really working out those muscles of going and meeting people and introducing yourself and really building those connections over time.
Yeah, and I think that that's something that a lot of people miss, and because that's a huge part of the education that you get or you can get from an MPH once you do apply yourself and put yourself in those spaces where you can meet a lot of people and you can network and learn new things, learn about different opportunities. And yeah, I'm very similar in the sense that I didn't have those kind of opportunities in undergrad, but I definitely took a hold of them during my MPH program to really just get the most out of it and just develop not only on like the MPH education side, but develop as a professional, and just really understand how all that works out.
Mm-hmm.
Okay, so after you graduated, you got this job at Prescribed Wellness, where I think you did a couple different things and had a couple different roles there. So tell me a little bit about how you got this job and then what you did in it.
During my master's program, what I wanted to do was do a hospital administrative fellowship afterward, right? To a lot of people, that's a gold standard of how to fast track your career, especially moving up in the hospital space. Well, I had interviewed and got to the final rounds for a handful of places, but none that really worked out in the end. So at that time, I had moved back to Orange County with my parents and sister, and I was kind of looking around opportunities in that space, in that area. Now, it was 2014, which meant that's when the Affordable Care Act went into full effect, right? So a lot of hospitals, a lot of large hospitals were what you would call belt tightening. They were kind of getting rid of some administrative fat, or they weren't hiring as many young talent as they could because they weren't sure what the future looked like, right? And then a lot of smaller, especially for-profit hospitals, they wanted somebody with, let's say, 5 to 7 years of experience to hit the ground running. And that wasn't me either. So I started looking outside of the hospital realm. I applied to all sorts of things, dental insurance and small practices and public health agencies and other things. So Prescribed Wellness is a software as a service company, a tech startup at that time. And I actually had found the role on Craigslist, believe it or not. That's between all the trash, all the scams and things and flakes on Craigslist. Apparently, there are some legitimate job postings. So that's how I found that one. I applied. I went into interview. I remember at that time walking in, the first thing I saw was a ping pong table in the middle of the room. It's a pretty small office, maybe 15 employees at the time. I was there 3 years. We moved 2 offices since then, from that point, and learned a lot, did a lot. So you were asking what did I actually do there? Yeah. What I had applied for was a data analyst position. But when I was interviewing, they were saying, well, the first 3 or 4 months, we want to put you into client support just so you can talk to some of the customers and get a sense of what our software actually does. And then once you understand that, then we'll move you into the data analyst role and then move you into a manager role later on. Now, in my 3 years at Prescribed Wellness, I never held the data analyst position because in a startup, things change as the company was growing, right? I did a lot of things, but if I had to sum it up, the main things were I was on the account management team for a little bit in what they had called a clinical services advisor position. So we were helping community pharmacies to grow beyond just dispensing medications, whether that meant doing medication synchronization, doing more vaccinations, doing MTM's medication therapy management, other revenue streams beyond just filling, beyond just selling pills and such, because the reimbursements kept getting squeezed on the medication part, so they wanted to do more professional services. So in that role, I was helping the pharmacies implement some of those services and using our technology to support those things. I also did some strategic partnerships with some of the our bigger name clients that we had worked with at the time as well.
Okay, and this is awesome because I don't think I've had anyone on that came out of the MPH and went into like a tech startup company to talk about that. So what advice would you give to someone that is coming out either of their bachelor's or their master's program and is placed into like a tech startup environment? What advice would you give them?
Are you asking more of how to get into those roles, how to decide on a company to join, or like?
Yes, let's take that. How to get into the role, and then more about how to like be successful in those companies, because it's a lot different from a general or traditional public health role.
The first thing I would say is, in choosing a company to work for, right? Now, of course, when any job that you're deciding whether to join an agency or a hospital or whatever, you have to think about why you're choosing to go there specifically, right? But in a startup, I think it's even more significant because of several things. One, it's not the same as working for a hospital that has 10,000 employees, and it's going to be, it was there yesterday, it's there today, it's going to be there 50 years in the future, right? You're joining a company, especially early stage, that who knows, 3 months, 6 months later, they might be out of business. So you have to really understand what that trajectory of that company is like, how financially sound it is, and so on. Usually, you also want to personally find it meaningful or really align your interest with that company, right? You don't just join a startup for the sake of joining a startup. You join a startup that you really believe in, the mission of what they do, and also you believe in the founders and think the founders are going to be successful. Because again, if the founders, if the company is not successful, you could be out of a job in a year or two. It's not as stable as, let's say, joining the local health department. In terms of what makes you successful there, obviously it depends on your role, but I would say the difference between success, let's say in a startup versus in a more traditional large enterprise, is things move and change a lot quicker. And I know a lot of job postings say, oh, fast-paced environment at this hospital and agencies. Yeah, maybe, but it's not the same as a startup, and especially not the same as an early stage startup where in a large enterprise, they may have an idea for a new program or service or whatever, and then they do all these analyses, they talk, they get approval from this and that person, they do alignment and even try to get buy-in from everybody. Well, in a startup, that timeline is compressed, and a lot of those activities are not done. Like, you're not there to satisfy everybody. You're there to make a difference for the organization, and at some level, the buck stops with somebody, right? Whether that's a CEO or the head of a particular department, and you're just going to execute, and things are not going to be perfect, and a lot of times they're going to be uncomfortable. But you have to be able to be okay with that ambiguity, as they say. Be okay with that discomfort of knowing that you're shipping products that are not 100% complete, because that never happens, right? You have to be okay with your role, what you're hired for, shifting over time. It might not be 100%, or 180-degree change, but if they need you to do something, you're not going to just say, no, that's not my job. You're not in a union. You're not in a, like, you don't just stick to your job description when you enter. You have to be flexible. You have to be adaptable to those things. And if you are somebody who wants to grow in your career, as I did at that time, and growth potential is still a big thing for me, you say yes to those opportunities that you think that you will learn from, and that puts you, helps you do opportunities that let you do different things, new things, grow in certain skill sets. That's why people can move up more quickly in smaller organizations, whether it is a tech startup or even small business or something like that.
Yeah, I appreciate those insights, because it is a whole completely different environment than a typical health department or hospital or health system. So I appreciate you sharing that, because I think that is very helpful, as I think more people are getting interested, but people in public health are getting interested in tech, and as I think they should, because there's a lot of skill sets that can be used to benefit a lot of tech companies, as well as they pay very well most of the time.
Mm-hmm.
And while you were here, I think you got an opportunity with one of your mentors to be a senior consultant at Healthcare Innovators. So you talk a little bit about how you got across this opportunity, and then a little bit about what you did. Yeah.
So as I alluded to earlier, networking started being a bigger thing in my life, and I met a lot of people. So one of my mentors I had met through a professional association. This one was they had like a pairing program, right? So you sign up as a mentor or a mentee, and then they pair you with somebody. You know, you go to this event, you talk to a lot of people, and you say, "Oh, I want to be mentored by this person," and they choose their top 3 or whatever. So I had met a mentor. His name was Tom Doherty, and we met up for lunch or dinner a couple of times. We just kind of talked very generally, right, about careers, about healthcare administration, learned a little bit about what he did. And then I remember one time he said, "Oh, I have some new projects coming in," because at that time he was doing some independent consulting, and he had some projects come in. He was like, "Oh, do you have time to work on these as a part-time gig?" And I was like, "Oh, well, I guess it depends on how many hours a week you need it to be or whatever." And it ended up being like 8 to 10 hours a week. So I was like, "Yeah, I can do that in the evenings or on weekends." So, thanks to this mentor, he had opened up this opportunity for me to learn a little bit about what he did, make a little bit extra income on the side there. Got a lot better at using Excel and looking at OshPod data and just working with data and making recommendations from there. So that lasted a little under a year, I think, maybe some 8 to 10 months or something.
Okay, awesome. And I think that's an important point that you highlighted, that this, like, you had a lot of conversations just generally. You said lunch and dinner with him, just figuring out different things, and then from that an opportunity comes about. And I think that's what people miss a lot of the time, is just like building those relationships, and then from those relationships opportunities come your way. And if you're like being genuine and building that relationship, they're going to be more likely to recommend you as one of their first people, or ask you as one of the first people to take on this opportunity as you were able to do, which I think is a great takeaway that people should take away from that experience you shared there.
Right. And at the same time, don't just go into relationships expecting something or taking, right? It's about giving first. A lot of times, and depending on where you are in your career, you may have more or less to give, but certainly you have to approach it with the mindset of, this is a relationship. This is not a transaction, right? You don't go in like, "Oh, do you have a job for me?" Like, no, if they do have a job for you, or if they can introduce you to somebody with a job, that's great. I think one of the misconceptions about networking is that, oh, you should network to get a job. And while it is true that you can get a job through networking, I find that that's, a very shallow way of approaching it, and also not a sustainable way, because, okay, now that you got the job you want, then what, you stop networking, right? It has to be a habit that you develop over time, and you have to feed those relationships, right? Nobody's doing things just for free. Now, certain people may offer to be generous with their time or their resources or whatnot, but you have to give back to the community as well.
Yeah, absolutely. And I think that's a very good point that you make there, because I think especially a lot of students, I've had a few people reach out to me on like LinkedIn. They send their resume and they ask for a hard ask for like a job or internship and things like that. And it's like, that's definitely not the best way to start off a conversation with someone that you want to like build a relationship with, that you want to pass opportunities with you. Like, as you said, ask like how you can help, or like is there anything that you can do to support the work that we're doing. And then I think like just continuing to build, and as you said, feed those relationships is just so important.
Right.
And then after both of these positions, because I think you did them concurrently, you moved into a position as Director of Marketing at Family Health Centers of San Diego. So before I ask you how you came across this and what you do, did you have a lot of experience in marketing before getting into this role?
No. So at Prescribed Wellness, I was never on the marketing team. I was, because of what we did, yeah, you could say a lot of the things that I was involved in was related to marketing, right? Some of those partnerships and going out and helping the pharmacies market to their patient base and such, but not a formal marketing role. No.
Okay. I just think that's cool to highlight, because it's a director role and you're going in there, but I'm guessing that they're thinking this person has done so much in their career, they have built on all these different experiences, and this is just something else that they can learn and they can navigate and make it impactful. So how do you?
Yeah, well, just to clarify, the Director of Marketing title, that was okay. So my official title at Family Health Centers is, I think it's Clinical Solutions Marketing Manager. But what the role entailed was helping to spin out a tech startup or a tech company, and the director of marketing role is what it said on my business cards for the tech spin out, not for the clinics themselves.
Okay.
Just want to clarify.
Yeah. Thank you for that clarification. Regardless, how did you come across this position?
This one actually I just found online. I think I found it on LinkedIn, applied, and then the recruiter had emailed me back saying, "Oh, can you please apply through our website?" And sometimes I'm like, "Why do you have to make people do that?" But fine. Yeah, and it had caught my eye because it was interesting, right? It's a large federally qualified health center, which for those who don't know, FQHC, which means that they are nonprofit clinics that take care of low-income patients, mostly Medicaid patients, also homeless and uninsured patients as well. But they had developed their own technologies, their own EHR system, practice management systems, even things like inventory and fleet management, all sorts of software that they used to run operations at the clinics. And then at that point, they were considering taking those technologies of the IP and spinning out a separate company. So they had, they were starting to build a team through the IT department and bringing in myself to help take it to the next level. Okay.
And how long were you going into there knowing that you were going to be part of the spin-off for the tech side of the company, or were you going in there with a specific role and then it just happened to unfold that way?
No, I went in with the expectation that we were spinning out a separate company. Yes.
Okay, that's pretty cool. That's a really cool opportunity. I feel like just going through that process. So I'm guessing that there were different roles that you had prior to on the tech side, and then to tell me how that all unfolded.
Yeah, well, I mean, I was brought in for that purpose. So, my role didn't necessarily change other than my day-to-day responsibilities, because coming in, they had a job description. They're like, when you come in, we expect that most of your time you'll be doing demos of the software to whatever, right, to these leads and people that they introduce. Well, that didn't happen because you don't really have leads when you don't have you're not doing any marketing yet for the company. And my role ended up being a lot more public relations and partnerships. I set up an event once. I had gone out to some practices. I had brought in the CIO or the chief, other chiefs from other FQHCs to come down and take a look at our software. So it was, I think I kind of molded the role as I saw the need at that time, given the constraints of what we were dealing with.
Okay, that makes sense. And in your experience, is this very novel for FQHC to spin off and create a tech company? Because I don't think I've ever heard of that before.
Yeah, no, absolutely. It's I was very impressed with seeing the caliber of the team there, and especially the products that they had built. Of course, this wasn't a product that they had commercialized, so it didn't look very pretty, but it worked, right? And for the organization overall, it was so the story is they had said at some point, at one point they were deciding whether to purchase or start building their own, right? Like most organizations, that when you're transitioning from paper to electronic, you start looking at these different vendors. But because of the team there at the time, they had decided, they had pitched the idea of like, what if we just developed our own? Because they were already a large organization, and the amount of money that they would have to pay an EHR vendor like eClinicalWorks or Epic or others, they couldn't sustain that in their budget, especially if those numbers continue to rise over time, right? So they decided, why don't we just start building our own and see where that goes from there? And thankfully, it worked out for them. They had built something that allowed them to scale and maintain those costs, without breaking the budget there. So I would admit, before coming in, my impression of FQHCs was, they're just old, and they're stuck in their old ways. They're not very savvy. They're not very good at technology specifically, but also even things like reimbursement models. They're just like running things the way that they've always run it, right? And that may be true, I think, of a lot of smaller FQHCs, especially the ones that were struggling. But at this particular one, I was very impressed with their operations and their technologies.
Yeah, I'm very impressed also, and I've only heard about them for a couple of minutes, so that's pretty awesome that they're able to do that. And yeah, I guess the cost savings does make sense if you have the team available to build out those kind of products that are just that you're going to continue to use going forward. And then the next role that I have here for you is an adjunct professor at the University of San Diego. So tell me about how you get involved into that, and then what did you teach?
Yeah, so as an adjunct, it's a part-time sort of thing, right? When they have a course open, they'll ask me, are you available to teach the next semester, right? How did I get this? This one I had reached out to the program director or somebody who had introduced me to the program director, but I was looking around different schools in the area and just kind of pitching to them. And I guess the reason that they answered my email or when I wanted to meet with me was actually before this, I had taught at another smaller school briefly. It's not on my LinkedIn. I had taught for a year as an adjunct somewhere else. So then they saw that, hey, this guy has teaching experience. We have some courses that he could potentially teach. So we kind of open up those discussions. I came in, met with the program director. Now, they didn't just hand me a course off the bat and say, all right, teach this next semester. They said, why don't you come in and do a couple of guest lectures? We have this course with this professor here. We're going to talk about social media and healthcare. And, we think that you may be able to, educate the students a thing or two about that. So I came in, I gave my lecture a couple of times. And I guess the feedback was good from that professor as well as from the students, that they said, oh, okay, why don't we get you on here as as an employee, as an adjunct, and see what opportunities come up from there. So I think several months or a year later or so, they say, all right, we're looking to develop a few more courses for our program. And one of it was a healthcare marketing course, specifically digital healthcare marketing. And they said, and they had contracted me to start putting together the curriculum for that. So we looked at the what the class is about, what the learning objectives are. Break it up into different modules. I teach mostly the online section of this, but there's an in-person section as well. So what the different modules are about, and then really start building out that whole curriculum, right? What textbooks are we using? What chapters are they? What are they reading? This week and the following week. What are the assignments? What is the assignment for the course? Just building that out, and that's basically the course that I teach now, whenever it comes up.
Okay, that's awesome. And I'm glad that you explained like the entire process there, because I know a lot of people are interested in becoming adjunct professors, and they probably aren't aware of the process. As well as I just want to highlight that you said that you were reaching out to schools in your region, just trying to get this opportunity. And I think that's something that people don't do, but being proactive in reaching out to get the opportunities that you want, that are going to benefit you in your career. So I appreciate that.
Yeah, and certainly it's, the opportunities, and let's say that depending on what your personal background is, what your degrees and such are, there are different opportunities that may be open to you, right? So, here, the school I teach at is a private school. So let's say that they have more flexibility than some of the state institutions. If I wanted to teach at the UC or the Cal States, usually you need a doctoral degree in public health or healthcare administration or something related, right? Versus if you were teaching at a private school or even a community college, usually you just need a master's degree. And it also depends on the particular type of work or discipline that you're in, right? Healthcare administration, very few people have a doctorate of healthcare administration, right? Usually it's like an MPH, an MHA, an MBA, or they may be a clinical professional that has some sort of business experience as well, right? But usually it's not, I think the difference between healthcare administration that we're in versus maybe some other areas of health public health is, usually it's seen more equivalent to like the business side, right? Somebody comes in with an MBA, they're not going to get a degree after that. Very few people go and get a doctorate of business administration unless they're going to be professors. I think the same thing applies here. Now, for other public health concentrations like epidemiology or biostatistics, I can see, those might require more of a doctoral degree, but yeah, I just want to share that as well.
Yeah, I appreciate that, because these are, I think, thoughts that a lot of people have, especially a lot of young professionals coming out of the master's program. So just hearing that and just knowing that, I think is important. So I appreciate you sharing that. So you're a writer and speaker at PurposeRedeemed, which you started in 2017. So tell me about the thought process behind creating this platform that you release, like informational videos and other content around.
Yeah, so definitely this has shifted over time, and depending on the season, there's been times where I spent more time on it, and some times that I've pulled back from it a bit. But in terms of creating it, I'll give you the backstory here, right? So at that time, I was I had a full-time job. I was working, and that was fine, but I felt like I wasn't making as big an impact on the world. Like personally, yeah, sure, I was helping the organizations that I work for or work with, but outside of that, I felt like I wanted to do more. I want to have, like, perhaps like yourself, having your podcast and other things. Having a voice out there to make a positive impact just on people, either in my field or outside, right? So I started thinking about what is it I wanted to talk about, like, well, what is my thing? And initially, this started as a blog. Initially I was thinking, all right, what do I have to contribute that is either a unique perspective or something that people need to hear? And I was thinking a lot about the purpose of work, or the idea of work, right? So in our society, I find that the idea or the concept of work is very distorted, let's say. On the one hand, there are people who just view work as a paycheck. They don't really care what they do as long as they can put food on the table, take care of their families and such. My dad is kind of like this. He's like, the point of work is to make a lot of money and take care of your wife and kids if you have family or whatever, right? Now, on the other hand, I think there are a lot of people who put their whole identity in their work. What I call it is, like, you put your source of significance in your work, whether it's your job title, your income, your status, and it could be the type A personalities who are always driven to rise in the ranks, climb the ladder and all that. It could also be people who are not quite there yet, but they, it's part of hustle culture, it's part of overworking, it's part of thinking, if only I had this thing, if only I made six-figure, if only I drove that car or live in that neighborhood, then I'll be somebody, right? And to me, that's not optimal, and that's not particularly healthy either, because as you see, when over the past couple of years, the pandemic, a lot of people lost their jobs. And if your whole source of identity is tied to those things, that just wrecks you, right? So personally, I didn't think that work was either one of the extremes where it's only the instrumental value of work, just making money, and it's not just like, oh, it's everything, right? I find that work should be personally meaningful. It should be something that has an impact on others, whether like if you're a clinician, on your patients, if you're a public health professional, on the public at large, right? Have an impact on others, and then something that that brings you joy, or something that fits your personality, fits your values, fit your skill sets. Something that you actually enjoy going and doing, right? So that's kind of the backstory of, like, if I had to say, what the foundation is, that's where that all started.
Yeah, I like that a lot, and I think that you're right on point there with saying that a lot of people tie their identity to their jobs, and like losing your job and losing your identity, that wreaks havoc on a lot of people's lives if they don't have any other identities that they can like claim to in their life. And I think as you said, that just speaks to like the importance of work-life balance, having a job that's also like purpose-filled, and really getting also joy from that. And I think it's always a game of balance, right? Because you got your life, and you got your other like other things that you do in your life, whether it's like a side hustle or whatnot, and then you got your job, and you just kind of make sure that you're balancing all of that. And I really like that idea for start that. So you said you started off as a blog, correct? And then
Yeah.
how do you get into the speaking part about it?
Yeah. So it's something that, I find, how do I say this? So it's something that I've used as a learning experience for myself as well. I often tell people, just explore, just start doing something, and you learn by doing. Yeah, you can learn by reading about it, and you should read about it, or watch videos and that sort of thing. But at some point, you just got to go and start doing. And it's going to be uncomfortable, especially if you've never done it before, especially if that's not what you would consider your, putting in your wheelhouse, right? It'll be uncomfortable, but you just start doing it. And then at some point you'll get better at it. You might not be like the world's best or whatever, but you'll get better, right? And that's how I approached it as well. I've used this kind of brand as, yeah, it's a blog at first, but let me reach out and, when an opportunity comes up at a local college or a professional association, or somebody I know is doing something, or somebody invites me to be on a podcast, I'm going to say yes, just to get on there, right? And share some of my views, and hopefully that brings value to people, right? I think part of it is having confidence in what you're talking about, knowing enough about it, and having like well thought out points and such, but also just do I really believe that this is of value to my audience? If not, then no, I'm not going to go out and make a fool of myself, right? But if I think that is something that is valuable to people, then all right, I'll put myself out there. It may be uncomfortable, but oftentimes, I'd say that we are our own harshest judge or critics, right? I may think, oh, I said too many ums and ahs, or I rambled on too much, and that's what I hear, and especially when I play back some of my recordings, I'm like, oh, it's cringy. But somebody else hearing it, that may not bother them, right? They're like, oh, well, I learned X, Y, Z from this, and that's what they took away from it, right? So, that's how I got into doing that, and I kind of worked on other skills there as well, doing some media relations, PR sort of thing. And, I think over time, just kind of build some credibility to it. And, although it's not what I do full time, it's not like this big thing or whatever. It is kind of partially a creative outlet, partially, experimental lab, of sorts. And, I don't think everybody needs to have their own like little brand or whatever, but I think, certainly if you do have one, you can leverage it for just trying out different things, and that's how you're.
Absolutely. And I think the point of just going out there and trying things, like I started off with a blog as well, and then look at me, I'm doing a podcast right now, which kind of all started from that blog. And it's not like blogging was hard, podcasting was hard, but you just consistently show up and consistently do it, and you get better, and then people just continue to see the value from what you're putting out. And the consistency, I think, is a huge part in it. But I guess the bigger part is like starting. Once you start, and then once you start, just keep on being consistent, keep on sharing, and you'll learn as you keep on going. And as you stated, that's what you have done, and that's what I've done with my platform. Just been consistent and just put out content, and just kept on leading from continuing to do that. So
Yeah, and I would say also, like, kind of understand your motivations, right? Like, what is it that you are looking to accomplish through it? What does success look like, and all of that? But also being flexible in that, right? Like, I think sometimes people start something, a TikTok, a YouTube, or whatever, thinking, oh, they're going to get 10 million followers and make a bunch of money. Realistically, very, very few people reach that level of success, right? But and to a lot of people, like to your point about consistency, it's a lot of people, they think, all right, I'm gonna get all 10 million followers, and they put out a bunch of things that they work hard on, and then like nothing happens, like it's crickets, right? And then they're like, oh, this is not a waste, this is a waste of time, I'm not gonna do this anymore, and then they go and try to do something else. And there, again, it depends on your motivations. If your motivation is getting rich quick off of something, then brace yourself for when that doesn't happen. If your motivation is just to educate people, or using it to build relationships, or using it for maybe even to support your job or support something else, then you can find creative ways to leverage it, right? Like you may not really make money from that one thing that you do, but because of the skills that you develop through doing that and experimenting and all that, you leverage it for something else, right? Like marketing, I never, like I said, I never studied marketing. I never started out in marketing, but I experiment with different things on my own, and build a lot of relationships, and got really good at building relationships, and then leverage it even for my my day job.
Yeah, I like that a lot. And yeah, just today I was going through like Instagram and going through like public health profiles on there. And to your point, it's like, what is your goal here? Is your goal here just to inform people? Because if it was to inform people, you keep on going. But a lot of them are just, as you said, they have maybe like 5 posts, and they're like, oh, this is a waste of time, and they just kind of stop doing it. But I think to that point, it's like just being consistent. Because when I started, no one gave a damn about what I was writing, to be honest. But I just kept on doing it, and my goal was to just help one person. And I think if you have that type of goal, it just keeps you very motivated, because all you need is one response from one person to say that was helpful, and then you're like, oh hell yeah, let's keep going,
Right.
let's do it. So yeah, I appreciate that. So is this what kind of like helped you? Because right now, if I go on LinkedIn, I'm probably going to see a post from you. You're probably the most consistent person on LinkedIn, on my timeline, that I see consistently, like all the time. So is this what kind of like transformed into you posting more on LinkedIn, or what was that thought process?
Yeah, no, that's a great question. And for me personally, sometimes from time to time I've thought like, okay, where is the delineation between just me versus this brand or whatever. And again, with the motivation thing, I have no ambition of getting 1 million subscribers or followers or whatever on these other things. But my posts on LinkedIn, I started being more consistent with that maybe a year ago. And part of it was, yeah, it was because I wanted to promote some of the stuff I was writing on the blog, and reformatting some of that content for a LinkedIn post. But also part of it was, so on my personal Facebook, every Sunday, I haven't been as consistent recently, but every Sunday before, I would post a reflection. And this is on my Facebook, so it's more of a personal, personal topics, things I've been thinking about that week. And I find that it resonated with a lot of my Facebook friends on there, and people reaching out to me like, oh, I've always felt that, but I've never been able to put it into words like you had, right? And some of those things are career related, a lot of them are not. But then at some point I thought, why don't I just start posting some of these types of things on LinkedIn, and especially the more career or business or networking, relationship building type of topics. So that's what I've started to do more on LinkedIn, and I think at this point where I'm really on LinkedIn, I built relationships, connections and stuff, but they also roll out this thing with followers, right? So if we were talking about building a following, I would say on LinkedIn is where if people like reading my posts, that's where they should follow or subscribe.
Yeah, absolutely. And I think LinkedIn is like the most underrated platform for creators out there right now, I guess outside of like TikTok, for like organic reach and all these things that Instagram has made like extremely hard. And to that point, I think a lot of people should maybe like focus more on LinkedIn, less on Instagram, because I think you get the double benefit of it kind of like helping you in your career and more visible in your career than posting on Instagram, which might be a completely separate thing that no one really gets to see from your professional side. And I also want to highlight that you said that you kind of like took the chance of sharing what you were sharing on your personal Facebook to LinkedIn, because you saw that it was resonating with people there. And people are people on all social media platforms. So like once you find a crowd on one social media platform, you're probably going to find another crowd on another platform that's going to be like would find value from your information. I guess one question that I would like to ask is like, how do you come up with your content, and how do you stay consistent?
Yeah, that's a good question. First, let me address what you were saying about the different platforms and such. Now, I believe that depending on what your field is, what your expertise, what it is that you are talking about, or for some people selling or whatever, right? It may be right for them on other platforms, right? It really depends on that. Obviously, Instagram is mostly photos, so if you're selling a product, product businesses do great on there, right? If you're writing about careers and stuff, that may or may not be the best outlet. So in terms of, and for myself, mostly I write, right? Especially on LinkedIn. So how do I come up with my, of what I write about? It comes from different sources. It comes from a lot of it comes from conversations that I've had with people, right? So whether it is somebody coming to me for advice, or chatting with a coworker or a friend, or seeing experience that somebody else had gone through, I talk to them about it, and it sparks further thoughts, right? It makes, that's the thing with ideas, right? You make connections between ideas. It's not like they say, there's nothing new under the sun, but or when you're writing, nothing is 100% original, but it is like you don't have to present something that people have never thought about or heard of. You just need to present it in a way that is valuable to them in that moment, in that time, or framing it in a way that they've not thought about, right? So a lot of it comes from conversations with people or observations of what's happening. Sometimes I start thinking about a topic, and then it's branches off into other adjacent topics. I'm like, oh, there's a connection between something I had read in, let's say, Harvard Business Review a while back, and this other thing that I'm reading in the news or talking to somebody about, and you just kind of have those connections in your mind there. I do keep a list of like things that I potentially will write about. There's probably a better way to do this, but I just email them to myself. So I have like a starred kind of thread of emails where it's like, okay, this topic here, that topic there. And it doesn't have to be long either. A lot of times it's like whatever's on my mind at that point. It could be 10 words, it could be a paragraph or whatever, and then I'll revisit it at some point and say, okay, have I thought through more of this? Can I expand on this? What am I going to say about it? I don't believe in putting something out there just for engagement, especially on LinkedIn. A lot of people with their polls that have no real meaning to them, or like they're just posting something just because it capitalizes on outrage, or it capitalizes on just a feel good sort of thing, right? I like to share something that makes people think, and especially something that makes people think and it helps them make a decision in their own life, whether at that point or perhaps in the future. So that's how I approach it.
Okay, I like that a lot, and I think that's similar to me. I take a lot of my inspiration from conversations, from like also like podcasts and different things that I listen to. And I would suggest Notion. Notion is what I use to like jot down those little notes, and then I love that you can go into it and then click on it and then create a bigger page and then write more about the thoughts that you have there. So that's what I've been using, just as a little plug. But yeah, I think that's important. And I think in you just saying that, it's so simple for people to create content, because it's just like we're listening to conversations, we're taking in our insights, and then we're sharing our perspectives of this insight, which I think is a unique thing. And once you're able to do that in a captivating, valuable way, people are going to continue to want to see that kind of content and get value from it. So So yeah, that like people try to complicate it so much, but sometimes it's just as simple as just seeing what you're doing and how can you get takeaways from what's happening in life and share that out to a broader community.
Yeah, what I find most effective, at least on LinkedIn, I can't speak for other other platforms and such, but there, there are a lot of people saying the same thing on LinkedIn, right? A lot of it. Sometimes people even blatantly copy others, and I think that's not right, but it happens a lot. I think when you're sharing something that is different, it has to be genuine as well, right? Well, it has to be genuine, but if you're sharing from your own personal experience or your own personal conversations or whatever, your own personal thoughts, then it comes across different. It comes across more genuine. It comes across as having conviction to it, not just the same drivel that everybody else is saying, right? You're not just going with the crowd. You're not necessarily swimming against the tide either, but you're providing your own perspective. And I think that's what's valuable, especially on LinkedIn. It's not about your company's perspective. It's not about, some companies, they want their employees to start posting about how great the company is and stuff. And so they even write like, or like it's for a holiday or it's for something, we won this award, and it's very scripted, right? And I don't personally, I don't like those posts, and I don't think that we need more of those posts on LinkedIn. I think we need more genuine, but also well thought out posts, not just like, oh, I had this thought, so I'm just going to post it online, right? That's save that for Twitter or something else.
Yeah.
Yeah.
Yeah. And I like that. And I think the authenticity is a huge factor in all of that, because it's just so important that you're able to really be yourself and share those perspectives from your own perspective and your own insights that you've gained throughout your story. Okay. Because I could talk about this for a very long time. Sure. And get deep into it, but let's move on. So you're currently a senior manager of strategic marketing at UCLA Health. How do you come across this, and then what do you do in this role?
Yeah, again, this one I think I just found it online and just applied for it. And what I do here, so when I started, it was a little bit different from, I'll share what I did when I started and what I'm currently doing now. When I started, it was more of like an account-based marketing, management type of role, where I had a portfolio of internal service lines: radiology, cardiology, pediatrics, ambulatory care, some others. Whenever they have a marketing need, whether it is like print material or some sort of website thing, or they want to do some ads, they would come to marketing, right? Hey, we want this. And then I would sit down and help them vet out their idea. What is it that you're really trying to accomplish? Are you just trying to get general awareness, just pushing it out into the social media, or is it about patient acquisition? Is it about growing the reputation of this department? Is it what is it that you're really driving? What does success look like? And not like the vanity metrics sort of thing. Like, who cares if you have 100 likes and comments and whatever, right? Like, what is it that you're trying to drive for the business? So I would help them think through those things, because a lot of people, they just want things that are visible, right? Oh, put it on all the social media platforms, put it on a billboard, put on this and that. Well, all of that costs money and time, which also costs money. So basically helping make better decisions, steward the budgets more properly, and try to make drive more effective results. So what I do now is a little bit different. Now I'm helping them put together these essentially these PowerPoint decks, right? Where for each department or each team, we're looking at what the market opportunities look like. How our previous marketing campaigns and such have been performing, really showing what it is that we've been doing. What does what do those metrics look like today? What does success look like in the future? Considering what competitors are doing, what Cedars and USC Keck and CHLA and other competitors are doing. Considering some market research of what it is that people want, what are they searching for? Patients, I mean, what are they searching for? What are the disease prevalence or the forecasted needs in the area to help inform those decisions more long term. So it's more of an upstream sort of thing rather than being more reactive, where somebody just wants a flyer or a website and then figure it out from there.
Okay, that's awesome. And thank you for highlighting that. Like the role of your job is shifted as you've been there. And how long have you been there?
Over a year and a half, under 2 years.
Okay,
around there.
That's awesome. And do you have any like tips on the marketing side for people in public health? Because I feel like that's also something that we don't get enough information or experience around generally.
Yeah. Well, I have an entire course on that, but I guess it depends on who those individuals are, what are they representing and such, right? I think one thing I would say, especially on the hospital side of it, is hospitals historically have not done a very good job of branding themselves, creating their own, whatever that looks like, and okay. For example, you take, let's say you receive these flyers in the mail, or these things in your email. A lot of times, if you cover up the hospital logo and you're just reading what they're saying or looking at the stock photos or whatever they put out there, can you tell what hospital or what health system it is? In a lot of cases, you can't, right? Most people can't, at least. You receive something, and this affects both small hospitals and large hospitals alike, right? A lot of the things that they say are very. It's not untrue. It's the same thing everybody else is saying, right? Oh, we have the best doctors. We have the best facilities. We have the newest equipment. We care, unlike these other hospitals, like all of that stuff. Like everybody says that. And what really differentiates you? What is your brand really about? I think there's only, I would say, less than a handful of health systems where people hear a slogan or like a motto or whatever, and they're like, oh, I know that's Kaiser. I know that's whatever, right? In most cases, it's like, well, everything just looks and sounds the same. Even most of the colors, it's either like some sort of shade of blue, which is like a lot of hospitals, or like some of them it's a red and like a red, white, black, gray sort of thing, right? It even looks alike. Like, now you don't stand out for the sake of standing out, but what is it about your brand that that you uniquely own? So yeah, at a high level, I would say that's something that health systems and hospitals and in public health agencies even can take away.
All right, thank you for sharing that. So before I move you on to the Furious Five, last part of the show, I wanted to ask you, where do you want to see yourself in the future?
That's a great question. I think based on my personal experiences so far, and especially in the last couple of years, also reflecting on my personal values and where my skill sets are. In the future, I think I would want to move more towards either entrepreneurship or working for some sort of firm that supports entrepreneurship and innovation, especially in health tech or ed tech, but open to other things as well. Now, what that timeline looks like, it's to be determined, but sometime in the future.
Okay, that's awesome, and we look forward to seeing how that all unfolds for you as well.
Yeah, and I think the other thing also, not healthcare or public health specific, but I enjoy writing, and I plan to write books. I'm actually working on something right now, so maybe I'll be back in the future here if you want to chat about it. Yeah.
Oh, please, and thank you. I'll definitely stay in touch, and we can get back and get you on when the book is complete, and we can talk more about that in the future.
Yeah.
Awesome. So moving on to the Furious Five, the 5 questions I ask all guests. So number 1, what advice would you give to a student trying to pursue a career in public health?
Yeah. There's a lot of things that you could be doing at this time, but broadly speaking, one thing I always tell people is go get experience in the things that you're interested in. Go be exposed to them, right? Whether that is a volunteering role, an internship, a part-time job, even a full-time job, if you want to do that. Go and talk to people in the field, do those informational interviews, or go to these professional associations, just meet people, just you chat with them, hear about what they what they do, and ask them questions, ask them good questions. Do your research ahead of time too. Like, don't ask questions that you can Google, right? But and the reason for that is public health is so broad, right? There's like all these things you could be doing, all these areas you can go into, all these different settings you can work for. And as a student, you might think, oh yeah, I want to do all of this, or I'm open to doing all of this. In reality, I think once you experience it for yourself, a lot of things you're like, no, that's not really for me, So, for example, when I was in grad school and doing that internship and part-time job at the Hospital Association in healthcare quality, at that time I thought, yeah, healthcare quality is something that I can see myself going into as a career, or at least that's what I initially thought taking the internship. When I actually saw what the work looks like on a day-to-day basis, I'm like, a lot of it boils down to collecting data and preparing for audits. And to me, that's not exciting or thrilling or whatever. Some other people might enjoy that, but to me, I'm like, I can't do this every day. I'm the type that wants to work on strategic projects, want to work on different things, different initiatives. Can I expand my horizon? And, of course, lean into where my strengths are, but I don't see myself doing that kind of work. So, getting back to my point, you may think that you want to do this. You may think that this is a great thing that helps people. It's hard to say that you're not helping people in public health, right? Everything ends up helping people, but is it really for you personally? That's a different consideration that only you can decide for yourself.
Yeah, great advice there. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
That's a great question, and I can only speculate on it. I don't know exactly into this, but I would say, well, one, I would say perhaps part of the reason I have this position is I have a lot of experience in healthcare, and I have a lot of public health, healthcare, and also I understand marketing and business models and such. So I think when we're talking about marketing, and this doesn't have to be for hospitals specifically, but for other organizations too, it's not just about the creative, right? It's not just about coming up with the best names and designs and logos and all those branding elements and such. That is important, but for many of these organizations, what they really really care about, like I was alluding to, is driving results. How does what you do drive the kind of results that you want? What does success look like? If it's patient acquisition, how do we get more patients to call? How do we get more patients through the door? And really understanding how the marketing can support driving those results, right? And this will differ depending on the type of organization or the type of business model. I think a lot of people in public health don't really think about things in terms of business models or business, right? They think, oh, I just want to help people. I don't want to touch the finances. I don't want to touch all that stuff. That's for somebody else. But you have to understand that, and this is true whether you're a clinician or you're just on the administrative side or whatever else. If you don't understand what if you don't understand how the organization makes money or what it's incentivized to do to maintain that or grow, then you don't understand why decisions in your organizations are made the way that they are made, right? For any type of role, but especially for marketing.
Well, I appreciate you sharing that. And then number 3, what's something you are working on improving in your life right now?
Yeah, one of the big things for me, especially in the past year or so, is considering how I'm spending my time. And I think this is something that a lot of people during the pandemic have been, making decisions on, or just wrestling through, right? So we can get into a whole discussion for this, but really, and this kind of ties into everything I talk about with work, career, identity as well. It's like the idea of intentionality has become a driving theme or force in my life recently. Is like, do I want to do this? And it's not, does somebody else, does my best friend think I should do this? Not if my parents think I should do this, not if society tells me that this is what success looks like, right? It's like, do I want to spend my time in this way? Do I want to do this? Do I want to continue working in this job? Do I want to continue volunteering in this thing? Do I want to, like even personal projects and stuff, right? At some point you kind of make decisions of, you can't do everything in the 24 hours that you have in a day. So you need to start deciding which things are not priority anymore. Not everything's a priority. Your priorities may, let's say you got to prune some things over time. And it's not like you can't think of it in terms of, oh, I'm giving up on this. It's, it's not a failure or success sort of thing. It's, do I want to or do I not want to? And what are the opportunity costs, especially in time for me? So, that's something that I continue to reflect on and, trying to practice as best as I could.
Yeah, and I think that's very important. And if you are interested, there's a book called Essentialism by Greg McKeown. Great book. I think that really focuses on like intentionality and like essentialism intentionally.
Yeah.
Just being intentional in life, because I think that is just so important.
Mm-hmm.
Number 4, professionally, do you recommend anything besides people following you on LinkedIn? Sure.
And besides following you for your podcast here, it's great stuff. There is a book. I had it here with me. I don't know. It's called Identity. Oh, it's blurred because of my. Okay. It's called Identity Crisis. With the subtext: healthcare branding's hidden problems and proven strategies to solve them. It's about a gentleman named Vince Perry, and I've read a lot of books that are, I've read a lot of business books, but I've also read a lot of books that are related to healthcare or public health. And this was one that, really stood out to me because it gave a different perspective. I've been talking a little bit about that branding stuff earlier and marketing and such. But, this gave me a different perspective on one, what branding is, and secondly, what branding's role is in healthcare and public health. And I think it's a good read. It's something that I recommend to my students in my course to read as well.
Okay, awesome. And I will link that in the show notes for anyone that is interested. And then last but not least, where can people connect with you?
Yeah, I think the best way is on LinkedIn. And you can share my LinkedIn profile with them there. Yeah, so if they have any questions or something, they can reach out to me there. You can follow or connect with me in there.
Okay, awesome. Well, I'll be sure to put that in the description as well as the show notes. So definitely go ahead and follow Christopher. He's dropping a lot of great information on LinkedIn, so be sure to tune into that. But thank you so much for coming on the show and sharing your insights. I definitely know it's going to be helpful for a lot of people in their public health journeys. So thank you so much.
Thank you for having me.
Truly my pleasure. So some housekeeping items, everyone. Thank you all for watching or listening to this. Greatly appreciate it. If you have not as yet, definitely subscribe, leave a like, or leave a review, a 5-star review hopefully, and share with a friend so it really gets out to more people. If you'd like to support the show, you can go to buymeacoffee.com/PH Millennial, or you can go to thephmillennial.com/support to find out all the different ways to support there. I will see you all next week.